So we're just going to share our experiences of actually working with the data once you get it. And in particular, we're going to talk about sourcing the data, the application process we went through, the linkage and transfer process, the cleaning when you actually receive the data set. Ruth will talk about some of the benefits of using linked data, and then I'll just come back to give a couple of slides of final reflections about what I've learned from the process and what I think could maybe have been done better. So because we're both based in public health research, our outcomes of interest are going to be health focused, but the example we're going to talk about today involves cross-sectoral linkage of education and health data. And the particular example we're going to focus on is the importance of secondary school education in the patterning of health outcomes in Scotland. So just a bit of background to this example. The aim of this work was to investigate how various health outcomes in Scotland were patterned according to educational status. So I started a post way back in August 2011 to begin working on this. And at this point, we didn't actually have any specific research questions, but we knew that we were going to be focusing specifically on school attainment or educational attainment at school leaving. So this work's important because there's several ways in which education may influence health. So better education can lead to better job opportunities and income. Better income often implies a higher socioeconomic position, and there's well-established links between more affluent socioeconomic positions and more favourable health outcomes. And also, being better educated can improve knowledge of how to live a healthy life and have a better understanding of how certain behaviours can affect health. So before the introduction of centres like UBDC, sourcing the data and contacting the data custodians was done by the researcher. So at first, we didn't know specifically what health outcomes we were going to be looking at, but we knew we were going to be using hospital and death records to measure health. So linkage to health data was going to be required. And in Scotland, health data are held by the Information and Services Division of NHS Scotland. So we then needed to source the education data. And in particular, we needed data on educational attainment at school leaving that could be linked to the health data. So the first possibility we considered was the Scottish Longitudinal Study, or SLS for short. So the SLS is based in census data, which is linked to administrative data and vital event registrations for participants. And around the time of the start-up of our project, so this was around the end of 2011, the SLS were also preparing to link to education data, which included information on attainment data for all participants. However, the education data for the SLS was only going to be linked as far back as 2007, so this information was not going to be available for everybody in SLS, which was going to mean potentially small numbers, which is problematic if you're wanting to look at things like rare events such as suicide. So another possibility was that we could access it from the Scottish Government, and the Scottish Government also hold education data because they're responsible for publishing statistics on attainment and so on. And the Scottish Government had actually already indicated to Ruth and some other people in our unit that they would be keen to share the education data for research purposes. However, as with the SLS, we were only going to be able to access data as far back as 2007, and this was due to some data quality issues with the data. However, unlike SLS, where the data back to 2007 were only going to be available for respondents, so this just small numbers, the Scottish Government data the data we accessed from the Scottish Government was going to be available for all pupils attending local authority schools in Scotland. However, a problem with accessing the data from the Scottish Government was that they don't have names of pupils attached to the data sets, meaning that linkage to the health data was going to have to be done based on restricted identifiers, which included date of birth, gender, and home postcode only. But we wondered whether we might be able to obtain names of pupils from another educational authority in Scotland, such as, or another educational organisation, such as the Scottish Qualifications Authority, just to help improve the linkage process and guarantee more robust links. So we began the data application process around the end of 2012. And the first step in this was to define our specific research questions. So the research questions has to be clearly defined for the purpose of the data application. So because we were only going to be able to access the education data back to 2007, it meant that we were going to be limited to studying the effect of education on health outcomes of young adults. So because of the young age of our cohort, we decided to focus mainly on mental health outcomes, such as suicides, attempted suicide and psychiatric hospital admissions, as well as alcohol and drug-related deaths and hospitalisations, and accidents and assaults. So once we had our research questions, we had to make 3 separate data applications to the 3 agencies which were going to be supplying data. So this included the Privacy Advisory Committee application to ISD to access the health data and also to request linkage of previously unlinked datasets. We had a data access application to Educational Analytical Services at the Scottish Government to access the education data. And then finally, the Scottish Qualifications Authority had indicated to us that they would provide names of pupils for use in the linkage process. So there was a separate application done to them to access the identifiers. However, just to note here that the process of applying for the health data and having the data sets linked has changed since May 2015, and the applications for health data and data linkage are no longer done through the PAC. So the health data we requested from ISD included all general and psychiatric hospital admission records from birth until the end of follow-up in September 2012. So we chose September 2012 as the end of follow-up to ensure the highest level of data completeness for the hospital record schemes, and at the time we applied for the data, this was September 2012. So we envisaged that any admissions after date of school and the end of follow-up would be treated as our health outcomes of interest, and any admissions that occurred between date of birth and date of school leaving would be used to create measures of childhood mental and physical health that we could go on later to adjust for in models as potential confounders of any health outcomes that occurred after school leaving. We also requested maternity records for cohort members and offspring of female cohort members. And then finally, we requested records of deaths occurring between date of school leaving and the end of follow-up for our cohort members. The education data that we requested from the Scottish Government included most importantly, school attainment data for all school leavers. We requested data from the Pupil Census Survey, so this collects data on socio-demographic characteristics, as well as things like any additional learning support needs the pupil had. We asked for attendance, absence and exclusion data, school leaving destination information, so this just collects information on where the pupil was. I think it's at 3 months and 9 months post-school leaving, so whether they're in higher education, employment and so on. And finally, school level deprivation information. And from the SQA, we requested our identifiers for use in the linkage process. So this included the forename and surname of the pupil, gender, date of birth, home postcodes, and also the Scottish candidate number. So Scottish candidate number is just a unique identifier given to all pupils in the Scottish education system, and it's also used for internal linkage of the education data sets. So linkage of these data, we're going to give access to a representative cohort of school leavers in Scotland that left a local authority secondary school during the period 2007 to 2011, and we would have the ability to study a wide range of health outcomes whilst adjusting for a wide range of education and health related confounders when studying the effects of attainment on health. So as well as having our specific research questions, having to specify which data we wanted to use. We also had to be quite clear in what variables we wanted to have extracted for use in our study as well. So this did actually mean looking or trying to find what was available in the data sets and list every single variable we wanted access to. So applications to both ISD and Scottish Government required these detailed lists of variables that were required for the research. However, if once you've received your data and you find that you're perhaps missing some information, so there's maybe a variable that you didn't request at the time of application but you need at a later date, having this or requesting this variable may require a separate sign-off approval by the appropriate committee. So I had instances of this with both the health and education data where I had to go back to ISD and the Scottish Government to ask for variables, and some of these did have to be signed off again. So I'm just going to talk a wee bit now about the data extraction, linkage and transfer process for receiving our data, and I would just like to acknowledge Professor Jill Pell and Dr. Rachel Wood here, who let me use this diagram and adapt it for our research. So there were 4 organisations involved in extracting, linking and analysing the data for this project. So we've got SQA and ScotXZ for supplying identifiers and education data. So ScotXZ are just the department within the Scottish Government that hold the education data. We then had ISD for providing the health data and for linking the education and health data together. And then finally, on the bottom right-hand corner, we have our units for merging, cleaning and analysing the final data set. So the first stage of this process involved ScotXZ transferring a file which contained restricted identifiers, so that was gender, date of birth and home postcode, and Scottish candidate number to ISD. And at the same time, SQA transferred a file containing full identifiers and Scottish candidate number to ISD, and then ISD were then able to link the education and health data based on the full identifiers, and they were able to generate an anonymised unique identifier for each individual. So the unique IDs were then sent back to ScotXZ along with Scottish candidate number, and ScotXZ were then able to attach the unique IDs to the education data set based on Scottish candidate number. And the health and education data sets were sent separately to me, and then I was able to merge them together based on the unique identifiers that had been provided. So in terms of the data transfer process, ISD actually sent me an encrypted disk through the post containing the data, and a password was sent to access it by email. However, ScotXZ sent the data using a secure file transfer system, and 2 separate emails containing a username and password that were required to access this secure file transfer system were sent. So all of these data are actually stored on my network drive on my desktop at work, which now would not happen. However, the only people that can see the data or that are permitted to look at the data are myself and my line manager, and both of us had to be explicitly named on the data application. So whoever you want to see the data has to be named on the data application. And so, as I said, the transfer and storage process has changed a lot since we received these data. You would no longer be able to store it on your desktop, and you would have to access it through a safe haven. So we'd anticipated that the data application and linkage process would take a while because the education and health data had never been linked before to this extent, and we also envisaged that there would be further problems with the data when we did actually receive it. So we received the first version of the data around June 2013. So now I'm just going to talk about 2 of the major problems I came up against that required new versions of the data to be sent to me, and then some more minor data cleaning issues. So the first major problem that I came up against with the data was when I was doing some cross-checks, that health and education data did not appear to be referring to the same person. So this was just when doing some cross-checks based on gender and year of birth, so when cross-checking between health and education. So just looking at the table on the slide here, we've got information for 10 of our cohort members. And in the second column, we've got year of birth as recorded in the education records. And in the last column, we've got year of birth as recorded on the maternity records. And if we just read across the columns, we can see that the date of births don't match up. So for example, individual 1, their year of birth on the education records was 1995, whereas on the maternity records, it was 1993. So I got back to ISD about this, and it turned out they'd sent an old version of the anonymised unique identifiers to ScotXZ for them to attach to the education data, so that when I tried to merge the health and education files together, the unique identifiers weren't actually corresponding to the same individual. So that was a fairly straightforward problem to fix. I don't think we wasted too much time in this. The second major problem I came up against, the education data was very messy. So some of the education data sets could have multiple rows of data. So for example, the pupil census survey that I mentioned collected information on additional learning needs that the pupil had. So if they had more than one additional learning need, they had multiple rows of data corresponding to each of these learning needs. So I was finding quite a few inconsistencies within individuals when checking all of my variables. So for example, looking for consistency within gender for an individual, I was finding that the values assigned to the individual were not the same across all their rows of data. So just trying to highlight that with the tables here. So the table on the left here, this is what we want to see. So we've got information for 3 of our cohort members here and gender. So looking at individual 1, we can see that they've got 4 rows of data, and for their gender information, they're consistently recorded as a male. Similarly for individual 3, consistently recorded as a female. So that's what we wanted to see. However, what we did actually see was shown in the table in the right-hand side. So again, for individual 1, we've got our 4 rows of data. However, for gender, out of the 4 occasions, they've been recorded twice as a female and twice as a male. And similarly for individual 3, with their 3 rows of data, they've been recorded as a female twice and male once. So basically I was having to try and come up with different rules, so go through every single variable in the data set and try and come up with a rule of what value should actually be assigned to this individual. So that could be using the modes, so the most commonly used value that they'd been assigned for that variable. So I spent quite a long time, about 5 or 6 months, cleaning the data set in this manner. So that was actually going through every single variable in the education data set, when I just happened to email ScotXZ about another variable that I'd been working on in the background. And at this point, someone else at ScotXZ had taken over my project, and it turned out something had gone wrong with their data extraction process, and I was told to delete all the data. So all the hard work, 5-6 months worth of work, was gone. So it deleted all the data, and I can talk about it now, but at the time, so we received a new, cleaner version of the data set around the end of February 2014, and in fairness, it was a lot cleaner. All of these inconsistencies within variables for individuals had gone. So that was major problems that required new versions of the data to be sent to us, but we did know that there was going to be some minor data cleaning, other minor data cleaning issues to deal with as well, and I'm just going to give a few. There were quite a lot, but I'm just going to give a few examples here so you can get the sort of idea of the thing you might be dealing with if you receive data like this. So one of the problems I came up against was that we had death records for individuals who then had further records, so that could be health or education records after their supposed date of death. So it looked like they died, but then there was more information available on them after this supposed date of death. So having looked into this a wee bit more, I found that most of these death records were actually for individuals who had been multiple birth babies, and that the death record was actually for their twin. So the decision we had to take, the decision that was made here was to delete the death record and keep all other health and education records for this individual. Another minor problem I came up against was that there was a mismatch between education and health records based on gender and year of birth cross-checks. So gender or year of birth didn't match up between health and education records, and the decision that was made here was to do a full exclusion of that individual. So this had to be a full record exclusion and not just deletion of health records, because if we just deleted the health records and kept the education records, then we might be assuming that that individual had not experienced the event of interest, but they had, but we would have deleted the health records so we wouldn't know. Or we could be underestimating any childhood mental or physical health problems which we were measuring using hospital admissions. So we took the decision to fully exclude these kinds of individuals. And another problem I came up against was that we had attainment records which were corresponding to awards that had been made after date of supposed school leaving. So I got in touch with Scott XZ about this, and they informed me that this could happen if an individual submitted work late, meaning that the award was made in the following year. However, it could also happen if the individual took further Scottish Qualification Authority qualifications in further education, so in college, which we weren't interested in. We were only interested in school leaving qualifications, not of any further or higher education. So the decision that was made here was to keep the attainment record of the date, if the date of award was within 1 year of school leaving. So we assumed that this would capture courses that were taken at school but had been awarded at a later date due to late submission of coursework, but it would exclude any courses that were taken at college. So despite all of these negative points, Ruth's going to highlight some of the benefits of using the linked data.
As we've heard this morning, we've got lots of legal processes that we have to adhere to. We've got frustrations from the data controller side in sourcing the data. We've got frustrations once you're sort of trying to access the data. So is it worth it? And I'm here to persuade you to keep going, and it's definitely worth it. You know, you'll get there in the end and you'll have a wonderful research project. I mean, obviously when you're using kind of routine data or administrative data, the data sets tend to be large and certainly much larger than any kind of survey data. And this can be in terms of the number of variables that you have in your data set, but usually the real benefits come in terms of the sample size that's available to analyse the data. And so that really means it's possible to study rare outcomes. As Kat's case, she's studying the health of young adults, and young adults tend to be quite healthy, and the biggest sort of cause of morbidity and mortality are mental health issues. And you know, even these events are quite rare. So if you were doing a survey, you probably wouldn't have enough events to be able to do any kind of like answer any like research questions. But if you're able to get data on the whole population, which Kat was eventually able to get, then you know you're able to do really sort of fantastic research and analysis with that. And also, using linked data allows for kind of like different confounders to be used in your analysis. Again, like taking Kat's example of her work on the health inequalities of young adults, that would be kind of difficult to do if you were just using the hospitalisation data, because the social position measure that you have in the hospitalisation data is you would have it's job-based, social class based on job. And for a lot of young adults, they're maybe not in their final job by the time, by that sort of age, whereas being able to link to education, it's a much more stable measure of social position. So being able to link to the education data, Kat's able to kind of I suppose that's given her a really good measure of the social position, and I think in future work she'll be able to look at not just the education achieved, but being able to like distinguish between different subjects and different grades in terms of health inequalities. Other work we've been able to do using routine administrative and linked data is to evaluate natural experiments. And what I mean by natural experiment is that kind of like a policy or something that's already in place, it's already occurred. So the researchers have not really been able to manipulate or randomise the intervention. So we don't know we haven't been able to assign people the control or the intervention. So we can use routine data to try and find a good control group or good control groups. So we don't have to do a randomised control trial. And we've got 2 grants from the NIHR to evaluate some of these natural experiments. And just really to give you a flavour of kind of research that I've been involved in over the years that have used routine data. So once you've done it all, you can look, there's publications out there, you can get there, you can go up and present. Using the maternity and birth records, we've been able to look at trends and inequalities in perinatal outcomes. Kat's talked a lot about her issues, but I think even she would, and she's had lots of frustrations along the way, but I think even she would say about the benefits. She's got a paper looking at the role of educational attainment and the relationship between perinatal conditions and suicide behaviour. She's been able to present her work to conferences, so it's really great to be able to talk about your work. And the evaluation of the health and pregnancy grant, that was one of the natural experiments we had. That report is now with the NIHR in their editorial process, and we've been able to do presentations to academics and policymakers about that research. So it's definitely well worth going. A couple of other projects that are sort of still underway. We're in the process of evaluating the Healthy Start voucher scheme, and we've been able to link survey data to routine administrative data. So we're able to use the rich survey data from the Growing Up in Scotland data set, and we've linked that to various health and social care data sets to get sort of real kind of hard outcome data. And again, we've been able to engage academics and policymakers right across the stage of that project. So that's sort of showing the benefit and the impact of what this research can achieve. As I say, we've been able to speak to the policymakers. So that speaks to what Leslie was saying earlier about if you can show what the benefit is, show what the impact might be. And the final project is one that we've been doing in collaboration with UBDC, and that's exploring the health of looked after children in Scotland. And we're linking the Scottish Government's, it's the Children Looked After survey with health data, mortality data and sort of pregnancy rates in order to compare the health of children who've been looked after, school-aged children who've been looked after with school-aged children who are not looked after. And this is kind of in the early stages, but it was really great to have UBDC on board with this project. We had a kind of research idea. We didn't really have like tied down research questions. We had this research idea about looking at the health of looked after children. We got in touch with Miriam at UBDC and sort of said, we're thinking about this project, what do you think, can you help us? And Miriam was able to source the data set, so we kind of knew there must be data out there, but we weren't really sure like what it was and what state it would be in and if we would be able to use the data. And she was able to source the looked after children survey. We obviously knew about the health data. She was also able to facilitate the application process, so she was liaising with the data controllers, saying what kind of data are you liable to share, are you likely to share with us, and what research questions might be acceptable to you. So she was able to help us refine our research questions. She liaised with the data controllers and helped again with the application processes. Kat said there's different agreements that you need to have in place and different ones that you have to do. So, she was able to go to Stacey at the Data Protection Office to find out what information we needed from them and what we were signing up to when we were signing our data access agreements, and really providing that expertise and that help and support. As for our researchers, we don't have necessarily all of that, and it was really great that we were able to link in. And currently the applications are in they're now in, we're now waiting for the data, so it's very early stages of this project. But a real kind of like note about this project, and something again, it's like a sort of positive use of these data, is that there's no other data sets available that combine this kind of like sort of social care details of children and their health conditions. You just wouldn't be able to do, even if you did a national survey of children, you just wouldn't have the numbers of looked after children, or even a flag potentially for looked after children in that data set. So it's really showing the data controllers of the benefits of saying, you have this data, we can do research on this data that will be able to help you then, you know, have processes and policies in place for, you know, in this case, looked after children. And I would definitely recommend going down the UBDC route. She had great help for that. So again, there might be frustrations along the way, but I would say it's well worth it. So, and I'll just hand back to Kat for some final reflections.
Yep, so just some final reflections on what I've learned. So as we've heard, linking previously unlinked data sets is a long process, but like Ruth spoke about, it can give access to large, rich data sets. One of the really important things I learned, which thankfully I had been doing along the way, was to document all the data cleaning decisions that you have to make and any cases that you're having to exclude. And this is particularly important if you're writing up results for publications, because you may be asked to provide details on any exclusion criteria that you've used. And lastly, I've learned to get in touch with data custodians sooner rather than later if the data seem more messy than expected. So I spent quite a lot of time trying to clean the education data, as I mentioned, but this could have been avoided if I'd contacted ScotXZ sooner to query it. But in my defence, I had just assumed that this was normal to do this amount of data cleaning, and all through the data application process, myself and my line manager had been speaking about how messy the data were going to be, because the education data had never been used to this extent in Scotland before. So we'd been speaking about how messy we expected it to be. However, some final reflections on what I think could have been done better in terms of being provided with the data. So one of the things was I felt that data custodians could have been a bit better at suggesting information that I might need. So when you're applying for the data, you might not be that familiar with it, and I found, I know it is better now, but I found it really hard. So when you're having to give lists of variables on your data application forms, I found it really hard to find where all this information was of what was collected by the different hospital schemes or whatever it was. And one of the variables I later found that I needed that I hadn't asked for, I only happened to find out about its existence through a chance conversation with a colleague. And if I'd known about this at the start of the application process and I could have requested it sooner, it would have saved me a couple of weeks of work trying to find other ways of cleaning the data without knowing about this variable's existence. However, I think having data agencies such as UBDC now and data experts that know the data and can help you more with the data application process will overcome problems like this in the future. So we just want to say thanks, and we're happy to answer any questions.